All right. Hello, everyone. Welcome to tonight's broadcast. Welcome to College Health MD. I don't think I did a proper introduction last week. So last week was our first time going live on this page. I know that many of you may be first-time visitors. So I just want to welcome all of you to College Health MD. My name is Dr. Nicole Rochester. I am a board-certified pediatrician, a former family caregiver, an independent health advocate, and the CEO of Your GPS Doc. And College Health MD is a division of Your GPS Doc. The mission of my company is to help individuals navigate the healthcare system. And as a college mom, I started to see a huge need in appropriate and accurate information, even before COVID, in terms of helping our kids with this transition to learning how to begin managing their own health, managing their own healthcare, on their own. And, we know as grown adults that this healthcare system is incredibly complicated and it's very difficult for even us to manage. And so certainly for our kids who have been sheltered under our wings for 17, 18 years, and then we just ship them off to college and expect that they're going to be able to do this with confidence and ease. So that's the main reason that I created College Health MD. So you can feel free to come back to this page for tips and information that will just help you navigate this journey, this transition. And really my goal is to help the parents support your kids during this journey. So I am so excited to have another very, very special guest here with me today. Her name is Dr. Alexia Gaffney. Dr. Alexia, I don't even know where to start, but Dr. Alexia, just so you guys know, y'all know that with medicine, we're board certified, right? That means that we have fulfilled all the requirements and taken the rigorous tests and all the other things. And so most of us ambitious doctors are board certified in one thing. So I'm a pediatrician, that's it. But Dr. Alexia is board certified in internal medicine, pediatrics, and infectious diseases. Did I get that right, Dr. Alexia?
Yes.
So
Yes.
she is a triple threat, and I could not think of anyone better to talk about this topic with us today. Today, we are talking all about Thanksgiving. Thanksgiving, I cannot believe it, but it's right around the corner. And those of you with college students, I don't know if you're stressing out like I am, but I've been stressing out for about a month over this. And there's a lot of information that we need to be aware of and that our kids need to know. So I couldn't think of a better guest to help me share this information. I'm sure I'm going to learn something as well. So welcome, 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 Dr. Alexia.
Thank you, Dr. Nicole. Thank you so much for having me on. I'm super excited to just lend my voice to your platform. If I wasn't a infectious disease doctor, I probably would have been an adolescent physician. So this is definitely, geared towards my crowd and geared towards the parents who, have college students who are traveling back and forth,
Yes.
or maybe didn't even go away this semester and dealing with having young adults, teenagers, people who can come and go freely, have driver's licenses, and are coming and going in and out of their homes. And right now, the stakes are so much higher than they've been over the summer months. And, the infection again is gaining momentum throughout the country. So there is a lot to be concerned about.
Absolutely. Yes. As you mentioned, it is running rampant throughout our country. You all, I don't know how much you keep up with the statistics. I actually took a step back a few months ago because I was like stalking the Johns Hopkins coronavirus site, multiple times a day. And I was like, okay, take a step away. But of course, in preparation for today, I did, look at the site and checked out the stats. And it's not good, you all. If you've been watching the news, you know that over the last few weeks, coronavirus, even in the parts of the country that previously had not really seen a lot of cases, it is spreading all throughout the country. I don't know if there's a single state that hasn't seen a surge in coronavirus. And as of 5:00 p.m. today, we are at 10,353,604 cases in the US, 240,688 deaths. And I was sharing with Dr. Alexia before we started that the very first time I did a Facebook Live about coronavirus was on March 7th. And if I'm not mistaken, there were like 30 cases of coronavirus at that time. So to sit here and tell you all that we have 10 million
Mm-hmm.
I mean, it's crazy. So
Yeah.
what I wanted to do, Dr. Alexia, is, well, first of all, do you have anything anything else you want to say before we kind of jump right in?
Well, I feel like we've been distracted, and appropriately so, from COVID-19 with the election and other things going on, people returning to work, gearing up for the holidays. And so in the last 2 weeks, we went from a high of 50 to 60,000 new cases a day to literally outpacing ourselves each day over the last 7 days. So in the last 24 hours, we've had over 130,000 new cases of COVID-19 diagnosed in the United States in the
In
last
24 hours.
24 hours, you know,
I'm trying to remember how long it took us to hit that first 100,000 cases. Do you
like
remember?
weeks or months.
I
I
think
mean,
months.
yeah, it took us longer to get to our first million cases than it took months to get to our first million cases. And then in the last, week and some change, we've surpassed 1 million new cases. So that is startling. It's shocking.
It really is.
It's disappointing, that we just can't get a hold of this thing.
Yeah.
But that is because there is just so much gross misinformation.
Preach.
We have half the country that still thinks this is a hoax.
Yes, which is unbelievable. Unbelievable to me. I'm gonna try not to get too political tonight, but
Yeah.
I mean, it's kind of hard not to when you're talking about coronavirus. Can
Yeah.
you share with us some general? I mean, I know by now most of you watching have a pretty good understanding of coronavirus, but as Dr. Alexia just alluded to, there's still some people out here that don't really believe it. And I know there's a lot of misinformation, especially on social media. So can you give us just kind of a brief overview of coronavirus, COVID-19, things that we should?
Sure. Absolutely. So, one thing, so coronavirus or COVID-19 is what we call a respiratory virus. It enters the body either through the nose, the mouth, the throat, or sometimes even the eyes. And what happens is we basically breathe in virus particles, whether it is from, if we were face to face together in a room as opposed to being on a platform, and we were face to face within 6 feet, even 10 feet of with one another, and I was sick, I don't ever even need to cough or sneeze to spread this infection to you.
Ugh.
So when we talk about this virus is airborne, it means that people infected with the virus can just breathe it out all around them. And those airborne particles can just float in the air, they can land on surfaces, and then you breathe them in, or you touch a surface or an inanimate object, you rub your eye, you eat, you drink, and that simply, the virus has entered your mouth, your nasal cavity, your eye. It goes to your respiratory cells that line the back of your throat and your airways. And then those little spike proteins that you see on the virus, whenever you see those pictures, that's what allows the virus to enter into your respiratory tract. And then the virus basically hijacks your cells and turns it into virus making factories. And that's how you end up with what we call massive viremia. You get spread of the virus through your respiratory symptoms, and then you begin to develop those signs and symptoms if you're going to be symptomatic, because remember, up to 40% of people can be asymptomatic but still spreading the infection. So if you do become symptomatic, people have varying degrees of infection, and it could be something as simple as a mild cold, some nasal congestion, some dry coughing, sore throat. There's that harbinger of symptoms where some people lose their sense of taste or smell. If that happens, you really need to isolate yourself. You need to get tested and confirm if you have COVID-19, and then you need to inform your contacts. But some people develop those lower respiratory tract symptoms. So, shortness of breath, chest discomfort, lots of deep coughing, and that can be associated with high fevers, flu-like symptoms like muscle aches, joint pains, fatigue. I've talked to people who've had really profound headaches with this, and it can impact the gut. So some people have had nausea, vomiting, diarrhea as part of this infection. And, that's just the straightforward, simple symptoms.
Mm.
Those who become moderately ill or critically ill, like the people who end up in the hospital, they often develop respiratory failure. So they need oxygen or breathing tubes put down or other types of forms of mechanical ventilation. People have gone on to develop blood clots in their legs, their lungs. People have had massive heart attacks and strokes. People have had kidney failure, liver failure that's left them on dialysis. And, I have patients who have recovered to
Mhm.
varying degrees, young adults who are, whether it's temporarily or permanently disabled because now they have scarring in their lungs and they require chronic oxygen and they can't go out and return to the jobs that they once did that required physical labor. I have a lot of people who were sick in March and April. They're still experiencing brain fog, or what, is being called
Yeah.
COVID brain, still experiencing, chronic joint pains and fatigue months out from the infection. I have a friend who's on dialysis as a result of having the infection, perfectly healthy, fit, picture of health, middle-aged guy who previously ran 10 miles a day, left the hospital after COVID on dialysis, could not walk from ICU paralysis. And, this thing has devastated people who, hit that list of risk factors and people who do not.
Yeah.
Um, so,
Wow. That is, I mean, you're just like, just hearing you say all of that out loud. I mean, it's just like a gut punch.
mhm.
Um, so, for those of you who, I mean, I think my viewers are people who are already in the know. I'm going to give you guys that credit. But if there's anybody watching who doubted that this virus is real, I hope that Dr. Alexia's description really, I mean, it just hits it home. I mean, this is very, very serious. And I'm glad that you mentioned, I mean, I'm sorry that you mentioned it, but early on we were told, and it's still true, that the majority of the sick people, the majority of the hospitalizations and deaths were among individuals with underlying health conditions. And I
Yeah.
think that kind of made some people, including college students and including college parents, kind of rest assured, oh, if my child gets it, it won't be that bad. And certainly the kids are feeling like, oh, if I get it, it's
Yep.
not going to be that bad. And that has been the case for many students. They've had a minor, some, like you said, flu-like illness, maybe a little bit of fever, chills for a couple days, maybe not even that. Maybe they just lost their sense of taste and smell for a week or two. But there have been previously healthy individuals, including college students, who have died from
Yeah.
coronavirus. So, it's really, really important that we understand the magnitude of this. I wanted to just share with you all that are watching a little bit about how colleges are handling COVID-19. And then we're going to really go into our discussion about some recommendations for you all and for me, because I have a baby. Well, she's not my, she's my baby, but she's not a baby. But my youngest daughter is a junior in college and she is preparing to come home. And so this information is pertinent for me as well. But in terms of the colleges, very similar to what Dr. Alexia stated in terms of the United States, we have just like we have had a very discoordinated response to COVID-19, the same thing, and we shouldn't be surprised, the same thing has happened across college campuses. And so unfortunately, there is not like a uniform policy that all colleges and universities are following. And just like the states are doing their own thing and making things up, the same thing has happened with colleges and universities. So some of you may have kids at schools that completely shut down, and well, all of them shut down in the spring, right? Last spring. But then some of you may have schools where your child wasn't able to go back for the fall. Everything is 100% remote, no on campus, no housing, that's it. And then some of you may be in a hybrid situation like I am, where my daughter is living in an off-campus apartment and her school did allow, I think, about 25% capacity in the dorms. They only have single occupancy throughout the entire campus housing, even in a 3-bedroom apartment. They only have one person
Wow.
in those units. And then, they limited that. And then they do have a kind of some very few in-person classes for the fall. And they kind of looked at what was some of the classes that really needed to be hands-on, some of the labs, some of the musical things. And then everybody else, they're all taking classes remotely, whether it's home with their parents or whether it's in their dorm or in off-campus housing. And then there's some schools that just went buck wild and just opened all the way up. I mean, I have friends who have kids who have roommates, which I still cannot believe that
Yeah.
they opened up dorms with roommates. But you know,
Yep.
some of the schools, they have roommates, all their classes are in person. And you know, other than maybe some social distancing in the cafeteria and things like that, it's kind of like business as usual. As we know, many of the schools that originally planned on doing in-person classes within a few weeks ended up having to shut it all the way down, you know, because not surprisingly,
Right.
it started rising. So, and then in terms of kind of just what are they doing with the kids once they're there, there's a lot of variability in terms of surveillance. And so, you know, you all can type in the comments, what's going on at your kid's school? You know, how are they keeping track of the kids? At my daughter's school, as an example, they have an app, and every day they are supposed to go into this app and, you know, they answer the questions that, you know, like all the symptoms that Dr. Alexia just mentioned, and whether they have been exposed to someone with COVID-19. And after they answer those questions, they either get an X or they get a green check mark. If you get an X, there's further instructions, you know, call the student health center, blah, blah, blah. And so you can't even go on campus without proof that you have that green check. And she was saying that in the past, they could just like swipe badges. Now there are humans at the entry places.
Wow.
And they are doing checks, and every single student has to show that app on the phone for the day and show that they got the green check mark before they are allowed entry. So I'd love to hear from you all, you know, what are they doing at your kid's school? Now, of course, my daughter keeps reminding me that people can lie. And she's like, Mom, that, you know, they could lie and say that they're not having symptoms. I mean, I hope that they're not doing that, but at least the school has gone to some lengths to create a system where every day the kids are supposed to check in. And then also at her school, in terms of testing, they are testing 25% of the entire college body once a week. And so they just kind of cycle through, you know, whoever, and this is off campus and on campus. Everybody that they know of who's, you know, there, they get tested they test 25% of the students once a week. And so you get an email saying, okay, your test date is next Wednesday at noon, and you have to show up. You know, it's mandatory. And if you don't get that green check mark. So of course that's not ideal. I mean, testing, some of these kids are probably going 4 weeks without a test, but you know, it's better than nothing.
Yeah.
And she's a student athlete. So on top of that, the NCAA has their own set of rules. And so the student athletes are being tested every 2 weeks, and that's also mandatory. And then, you know, there's variability in terms of enforcing like the social distancing. You know, we've all seen the pictures of the parties and the big social gatherings and things like that. And so some of the colleges and universities have the infrastructure to better, you know, monitor that type of activity and to shut it down. Or, you know, there have been students that have been expelled, suspended. And then there's some schools where either, I don't want to say they don't care. I think a lot of schools just don't necessarily have the funding
to keep up with all of it.
Exactly. So that's a whole nother part of it is enforcing, you know, the mandatory mask on campus and social distancing and all of those things. I saw a New York Times article that said that there have been 252,000 coronavirus cases across college campuses, and that includes employees since the pandemic began, and at least 80 deaths that they can document, most of whom have been among employees, but there definitely have been some deaths among college students. So with that in mind, this is a hot mess situation. I mean, we have a very contagious virus. We have young adults who, I mean, it is literally their job to just like be free and, you know, and they're testing their independence. They tend to not have, their risk tolerance is much higher, I should say, than most of us. So it's like a perfect storm.
It absolutely is. I mean, think about it, right? Think about our training in pediatrics. Think about in preparing students to go away to college, right? We make sure that they're vaccinated. You know, they get those titers. We make sure they don't need boosting. It's when we get them prepared for meningitis vaccines. Yes. And we talk about college students and young military recruits being a population that is at extremely high risk for communicable or contagious illnesses and infections. And so we've known this forever,
Yes.
We've known this pre-COVID. And even with that, it's just like, yes, take your little crazy adolescent brain, risk-taking self,
Oh,
sharing cigarettes, passing the drinks,
oh,
eating each other's foods, you
oh.
know, serial dating and serial monogamous selves, and get in there and go learn something. And then COVID comes with them,
Oh
So
God.
it's like, and like frat houses and sorority houses are still open. And I'm
Crazy.
like, how?
Absolute insanity.
I mean, yes, I understand dormitories being open and, doing individual rooms or trying to cohort students and having had them screen before they got there. They were
Yes.
arriving well before classes started to isolate. But then there was no true regulation and monitoring of their social activities and their activities outside of school. And, no monitoring, pandemic, and crazy adolescent brain. And you've got yourself, words I won't say on your show.
A minute ago when you said crazy I was like, oh, when you said adolescent.
Crazy adolescent brain.
I was like, oh, where's she about to go with this?
Crazy adolescent brain.
But we can also say the crazy, the other A word,
Mm-hmm.
they can be that as well.
Yeah.
So now here we are. It's November 11th. Thanksgiving is just a couple of weeks away. Many of us have not seen our babies, since we dropped them off back in August, early September. And now what? Like, many of the students are coming home and they may be coming from areas that have, a higher rate of COVID than where their family members live. Or even if they're in a relatively lower risk area, they may be practicing, higher risk behaviors. Over the summer, they were home with us. They were pretty much on lockdown. And now they're just out, we don't have any control over what they're doing. And they're no longer in our bubble, so to speak. They're not part of our immediate household, or they haven't been for these last few months. So there's a lot of risks associated with our kids coming home for Thanksgiving, coming home for any reason. But of course, Thanksgiving is, just there's going to be a lot of that going on. And there's a lot of articles that I've seen already. Some of these towns are like, no, like they don't want your college kids coming.
Yeah. And I agree with that. I feel like, if universities can, they just as well let the students stay in their dorm for the holidays and deliver them prepackaged meals. Why are we letting these students get on planes, trains, and in automobiles to come home and potentially bring COVID-19 with them? I think about when we left for the holidays, we often carpooled. You live in Maryland, I live in New York. I'm gonna ride with you to Maryland and catch the Greyhound the rest of the way. And so the risks are just too high. And college age students may have older parents, they may live in multi-generational households, and so they may be exposing aunts and uncles and grandparents or other vulnerable people in the household to the virus. And it's just increasing the odds that we're going to be exposed. And so the first thing I would say is that if your college student can stay put, if they live out of town or they live in a dorm or off-campus housing, I would let them stay where they are for this Thanksgiving holiday. Like,
okay,
we've all had turkey and ham and mac and cheese before, and I understand it's delicious and wonderful. I'm going to miss my plate too because my family canceled Thanksgiving. Because we just have too many vulnerable folks, and who could live with, I brought my dad or my mom or my sister and her newborn baby COVID. Who could live with that? So I think people really need to ask themselves, would you be able to live with the guilt of exposing someone you love to this virus? Would you be able to live with the guilt that your child, came home at your insistence and, got you sick or you got them sick? It goes both ways. They're young and healthy, but they're still susceptible. And sadly, many people across the United States are going to lose children and lose teenagers and lose college students to this infection, even though, we have a better handle on it than we did in March or January when it first touched down in the United States. You can't say we have a handle on it, so we're now free to move about the country. We're not.
Yeah. All right. So you guys heard it. I mean, we're going to go into some ways that we can maybe be a little safer. But
Mm-hmm.
Dr. Alexia has said that the best thing, honestly, is for them to stay where they are. And I saw at least one school, I can't remember which school it was now. It may have been University of Michigan, who recently had a big surge, but at least one college has their, I don't know how they're going to pull this off, like legally, but they are mandating that their students stay there. Like they are saying that they're not allowing their students to leave campus, or at least those that are living in
In the
on
dorm.
campus housing. So maybe maybe if they leave, they won't be able to get back in. I don't know what they're doing.
It
And
makes
then,
sense to me.
like you go back and your badge doesn't work anymore. But
Right.
there are some schools that are, in terms of testing, I've seen a variety of policies where some of the schools are just encouraging, they're encouraging
Right.
the students to get tested that week or so before they come home. And then they're encouraging them to quarantine once they go home if possible, get tested again before they come back to campus, and then quarantine again
Yeah.
when they're back on campus. What are your thoughts about, for those of us, I did share, I mean, as of today, we were planning on my daughter coming home. She's only about an hour and a half away. Not that that matters, but she's an hour and a half away. She was going to drive, and she is not quite as anal as me, but almost. In fact, she's had some struggles, like dealing with everybody else not necessarily being at quite as serious as she is. That's a whole nother story. But so for those parents who, for whatever reason, have decided that they really want their child to come home, and we know that that is not the best decision,
Mm-hmm.
what are some things that we can do? So if we start with testing,
Yeah.
are there any recommendations that you can make in terms of our students being tested, and even us, who should be tested? When should they be tested? Does it even matter?
Yeah, so I think if they could be tested at least 72 hours before they are coming home,
Mhm.
or in a time frame in which they can actually get the results, right? Because remember, early on in the pandemic, people were getting tested and then hopping on planes to travel for business or to go back home, and finding out mid-flight, finding out on the tarmac,
Mm.
by the way, sorry, you have COVID-19 infection. So they need to do the test in a time frame in which they can get the results before they travel. But once they get tested, they really need to just stay home and isolate, because just because you didn't have the test today on Wednesday doesn't mean you can't go pick it up tomorrow or Friday. And,
Yep.
then you travel home and pick it up. And then that's the thing, right? How far are you traveling? How are you traveling? You may have left with a negative COVID test, but you might board that plane, train, or get in the car with your friends or classmates or your neighbors' children, because y'all all go to school together, and somebody
Mhm.
in the car has it. So, you might, if you were traveling with other people, maybe you would establish a little travel cohort, and everybody get tested, everybody agreed to stay home, stay put, wear their
Mhm.
mask, and hopefully get back home COVID free. But if you had to do significant travel, maybe even get tested when you arrive home. I mean,
Yeah.
I live in New York State, and New York State has some really strict travel restrictions.
I have
And
seen it. Y'all put everybody on the list.
yeah, yeah.
Maryland, I live in Maryland. We've been on and off of you all's list multiple
Hmm.
times.
Yes. So, look at what other states are suggesting. That's a good guideline. Like, see what New York State requires and try to see if you could mimic something like that.
Yeah.
If our rules haven't changed, I do believe you have to be tested 72 hours before you board a plane in New York.
Mhm.
Some destinations are requiring that you get COVID tested when you arrive there.
Okay.
And then you have to get tested to get back on a plane coming to New York. And then you have to be tested again 24 to 72 hours after you arrive home. And you still have a mandatory 14-day isolation period with contact tracing.
Ooh, when you come
So
back,
when you
14
come,
days. There you go.
so, you know, and expect that kind of scrutiny if you live in a state, a town, a city, a county, that is requiring that for travel.
Yeah.
You know, the rules are different everywhere you go. So you might even just want to check the rules where you live. Can my child come home? Will they have to
Really
do
good
contact
point.
tracing?
Yeah,
Yeah.
I'm so glad you brought that up because at my daughter's school, she goes to school in Delaware. A lot of the kids there are from New York. And, I was following the parent Facebook group, and over time, over the last couple of weeks, many of them, because of the list and because of y'all's restrictions, and because, their break is only like 6, 7 days, if that, I think it's 6 days. So they
Can't
can't
meet
even
the criteria.
quarantine.
Nope.
Exactly. So you started seeing the posts from the parents in New York and some other states saying, my
Yeah.
child can't come, like my child can't come home
Yeah.
because there's no way that he or she is going to even be able to do that 14-day quarantine. Like it's just not feasible.
Yeah.
So
And
I love that idea of checking out the states where, looking at the regulations for the state where they're from, where their school is, and also where they're going to be traveling home.
yeah.
Because maybe it may not work out even if you wanted to.
Right. And I think New York State may have some fines associated with
Mm.
not keeping the quarantine and isolation rules around travel.
Okay.
So, one of my patients said to me it was a $10,000 fine. I don't know if that's for people or businesses or what, but I'm like, $10,000 turkey dinner? I'll stay home. Like that's, an inexpensive car. That's a nice used car. Like down payment on a home. There's a lot we could, a semester of tuition at a state school. There's a lot we could do with $10,000 if that's true. So, you really have to read the rules. They are changing day to day.
Yes, that's another very important point I feel for parents who have kids that are far enough that they have to fly and book travel. And I don't know what the refund, I know I had to cancel a very important trip, 50th birthday trip back in April. And back then, everybody was canceling, but I don't know if the airlines and things like that are still flexible in terms of cancellation.
I feel like
hopefully they are.
Hopefully, but I feel like the airlines have to be like, it was a pandemic, I canceled travel in early March, first week in March.
Mhm.
And the company that I purchased my travel insurance through on like February 7th or 8th had changed their insurance policy, and they added in a single line that said pandemic.
Wow.
And yeah. And so, those rules are also changing day to day. So I wonder if you can even buy travel insurance, like that, because
probably not, because
it's
they
just a
would all
different
lose money.
situation.
Yep.
Yeah.
That's
So,
a good point.
at this point, I understand that flights are cheap and it's tempting to travel, but you couldn't pay me to get on a plane right now. Barring life or death situation, like I'm never going to see somebody again,
Yeah.
But to come home for turkey, no.
That was going to be my next question. So again, I'm so glad. So Dr. Alexia is not, she's showing all of her cards, y'all. We're not sugarcoating this.
No.
We know that every family has to make their own decision, but we're just giving you the information, okay, based on science.
Right.
Your planes, I have not flown as well. I don't know when I'm going to feel comfortable flying, but I do have friends, even doctor friends, who have to travel for, fly for their
business,
jobs,
for work. Yeah.
And thankfully, they're fine. Thank God. But if a student is coming home on a plane, what are some things that they should do just to maximize their safety, to minimize their chances of contracting coronavirus, knowing that it will never be 0%, no matter what they do?
Exactly. So absolutely wearing a mask, wearing a face shield or some other sort of eye covering, keeping the mask on the entire flight. They might no eating. Like, I love a Lorna Doone cookie as much as the next girl, and my Biscoff and my stale airplane coffee. How I love it. But I'm not going to risk my life on it, right? There's nothing on a plane to eat that should compel you to take your mask down and put your hands to your mouth.
Oh God.
Yes.
So the last time I flew was the weekend of March 13th, and it was right before the whole country shut down. And I had
just because of my cancer diagnosis and risk, had been in the habit of wearing masks on the airplane. And like half of the people on the plane had masks on and half the people didn't. I had also already been in the habit of like wiping down and disinfecting like the window. I always try to get a window seat. I try to sit towards the front of the plane because the air is worse in the back of the plane. So if you're going to fly, you better be strategic about where you're sitting. You know, even pre-COVID, this is stuff that's been studied and stuff we talk about in the infectious disease world. You want to sit towards the front of the plane, not the back of the plane, because the air gets real funky back there. So you're more likely to pick up a respiratory illness in the back of the plane than the front of the plane. So, you know, pick your seat, wipe everything down with disinfectant wipes. So I had my gloves, my disinfectant wipes. I wiped the window because I know I'm going to fall asleep and lean on that doggone window. So I wiped everything down, the handrails, the seatbelt buckle, the tray table and all that stuff. Pulled off, like remove my gloves like you would in a healthcare setting, right? Flip them inside out, put them in that little barf bag and sanitize my hands and just kind of sat there, you know, with my hands in my lap. And like I offered the guy next to me, I'm like, bro, you want a mask? Because I got a mask. He's like, no, I don't think that's necessary. Right. And I had this big giant hood. I put the hood over my face and I just like curled up in that corner and did the best I can, because this was before, you know, every other row and all that kind of stuff.
Yes.
So, you know, clean up the space you're going to be sitting in, clean your hands, don't rub your eyes, don't touch your face, don't eat anything, don't take your mask off, and, you know, heck, try not to get up and go to the bathroom if you don't have to.
See, that would be my issue. That's one of them. That's why I don't know when I'm going to fly, because TMI, but I know I'm going to have to use the bathroom at least once. And I already hate public bathrooms, and I really hate
the airplane bathroom is the worst. It's so tight,
those tiny little bathrooms. You almost can't get in there without mistakenly touching something. Oh God, just the thought of it. Dr. Yvette, hey, Dr. Yvette, y'all, she's the travel MD.
Yes.
So she has put some really good tips in the chat. Thank you, Dr. Yvette, for putting those there. I appreciate you. All right, that is really good advice. What about if you mentioned some kids may carpool, you know, they may, it's not recommended, but if they do, I know even when my daughter is going back and forth to like track practice with even her roommate, sometimes she will sit in the back, you know, open the window halfway and put on a mask.
Yes, you should wear a mask in the car.
Okay.
Yes, if you don't live in the house with someone and you're riding in the car with them, you should wear a mask. Okay. Even if you use things like, you know, Uber and Lyft, you'll see they have their drivers post that they are wearing masks and that they expect their passengers to wear a mask too. Even if the windows are open, you still want to wear a mask if you're in the car with people who you don't live in your household with.
Okay, excellent, excellent. Speaking of masks, I am compelled to do this, you all, because even in November of 2020,
people still don't know how to wear masks.
Maryland. I mean, Maryland is we are a mask wearing, at least in my county in general, we are a mask wearing state. I live in a mask wearing county. So, you know, I mean, the whole time, like if you are seen somewhere without a mask, you will, I don't even know what may happen.
You'll be shunned.
Yes, you will be shunned. Like you may be stoned like back in the day. So I'm thankful for that. But I cannot tell you how many people I see traveling, you know, in the stores and things like that in public places with their masks worn the wrong way. So I just want to demonstrate. First of all, when you're picking, and you correct me if I get anything wrong, Dr. Alexia. Okay. I know you all aren't doctors, nurses, you know, healthcare professionals, but honestly, during this pandemic, you need to pretend like you are.
Yeah.
Because you're now wearing some of the same personal protective equipment, PPE, that we wear in the hospital when we're taking care of patients and in our offices. And so you want to handle it by the straps. You don't want to touch the inside of it. You don't want to touch the outside of it. Let me back up. First, you want to wash your hands before you even touch this mask, because this mask is going on your face. So you want to wash your hands. If you're somewhere where you have access to soap and water, at least 20 seconds. If not, hand sanitizer, at least 60% alcohol. Once your hands are clean, you want to pick up your mask from the loops and you want to put it over your nose, put it around your ears, and then you can adjust it needs to cover, I hope you guys can still hear me. It needs
Yeah.
to cover your nose and your mouth.
Yes.
For the love of God, if I see one more person in a store like
I
this,
know.
I'm gonna freaking, I don't,
It's just like it defeats
or
the
like
purpose
this.
of having a mask. Yeah, it's
Right?
not a chin strap.
Like you put it on to get in the store, and then you just. So guys, can you explain to everybody why the nose and the mouth needs?
Mm-hmm.
Oh, and before you do that, so now, okay, I'm doing this. Don't do what I just did. I'm touching.
Yeah.
That's only because this mask is not contaminated. Once you have this mask on, do not touch it.
Yes.
And if you touch it for some reason, if you have to adjust it, please immediately wash your hands.
Right.
Now you're done with your outing and you want to go back to those ear loops and take your mask off with the ear loops. Now, when I'm in my car, I have a little plastic bag that I'll toss it in. If I can't find my plastic bag, I will throw this thing right on the floor, but I just immediately get it away from me.
Yeah.
And then once you've taken it off, you're washing those hands again. And then you can, drive or go whatever you're doing.
Yeah.
So yeah, can you explain briefly like why the nose and the mouth need? You already kind of talked about it at the beginning, but for those that may have joined us late.
Yeah. So your nose is direct passage to your entire respiratory tract. I mean, even when we are testing for COVID, we're swabbing up the nose and we're using a flexible catheter that touches the back of the throat. So the respiratory cells that line the inside of the nasal cavity, the sinus passages, and the back of the throat all have those little receptors that the COVID virus latches onto to get into our cells and start to replicate itself. So you might as well not wear a mask if you're going to wear it underneath your nose, or if you're going to wear it like a chin strap, then why? Because at that point, even if you had it on at some point and you were walking through a store or the pharmacy, or you had to conduct business and you collected some viral particles on that mask, but they didn't enter your respiratory tract because they landed on that mask. Well, now with you wearing it under your nose or wearing it as a chin strap, or you keep adjusting it or keep pulling on it, you're exposing yourself to more virus. You have to assume that that mask is dirty. And the other thing I see is that, people wearing surgical masks, they'll come into the office with them on inside out. And I'm like, well, do you wear it on the same side the whole time? Or you just flipping it back and forth? What's going on, ma'am, sir?
That's a good point. So that's a really good point. You all like once the mask, like she said, the outside.
What's the outside?
And like I love this particular mask because I don't know if you can see it on Facebook, but there's a print. So it's very easy for me to know, which side is out. And same thing with the surgical mask. They're going to be usually blue on the outside or green and white.
Right.
So you've been wearing it this way and all the virus potentially is out here. And then you mistakenly flip that thing around.
Flip it inside out and put it on your face before you've washed and dried it. Lord, help us.
We're like falling apart.
Yeah.
Okay, so speaking of masks, Dr. Alexi, get back to our students coming home. Let's say they've done the testing, they've gotten their negative result. They're now walking through your front door. Should they have on a mask while the entire time that they're home with us, even if their test is negative?
Yes, because if they've traveled, right, they technically should still, when they're re-entering your cohort at home, they're an outsider.
Yeah.
So your outsiders need to be quarantined or isolated for 14 days. Well, the holiday break is maybe a week at best. Yep. So they need to have a mask on when they're in the house. You still need to keep 6 feet or more distance.
Okay.
So if that means, putting that leaf in the dining room table and expanding it, so you and Junior are, 6-9 feet or better apart.
Put them at one end of the table and we sit at the other end.
That's right. If so that, they need to be in their own bedroom and have their own private space. And if you can, even their own bathroom, so that they aren't, breathing COVID all over the place. You have to assume the absolute worst. And the absolute worst is that anybody who doesn't live with you or anyone who is leaving the home, if you are not, could always potentially bring COVID home. And, I'm the person who leaves the house in my household. And so, I'm very vigilant about wearing my mask at work and wearing my mask to the grocery store and to the pharmacy and all of that stuff. And I'm very cognizant of wearing my mask, even if I'm sitting outside with a friend. The weather's getting cold, excuse me. And so, people are getting tempted to gather indoors because we no longer have the safety of being outside. But even outside with friends, I have kept my mask on.
Yeah.
And so you have to hang with people who are like-minded, but you also have to remember, like, if that person doesn't live in your home, they're not your cohort, and you pose a risk to them and they pose a risk to you. And we have to really take this thing seriously. Every time I do anything the next 14 days, I'm like, does my throat hurt? Is the heat too high? Why is my nose stuffy? What's going on? Like, I am bugging out.
Same here. I mean, a few days ago, I had a sore throat and I was like, wait, okay. I went to the grocery store 2 days before that. I haven't been anywhere else. And I'm like you, I'm like freaking out. Like, okay. And I'm like, at least 3 or 4 times I've thought, should I go get a COVID test? And then a few hours later, whatever little minor symptom I had has gone away. But yeah, like, we need to be hyper vigilant about this. We really do.
And we need to encourage our children, our students, to speak up about symptoms. Don't try to hide them. Don't get stressed out like, oh my God, mom, dad's, grandma's going to be upset because I got sick. Be forthcoming if you don't feel well, so that you can get tested, so that you can know, or so that everybody else can go don a mask, in the house, if that's what needs to be done. The masks don't just necessarily come off because we're in the house,
Yeah. I think that's really important. That's something that I personally have been trying, struggling with in terms of, because my daughter's planning on getting tested 3 days before she's coming home. And then the day before, in her school, they have a turnaround time of about 2 days. So when that second test, she probably won't get it back and for another day after she gets home. And she did come home for a just 1 day of a weekend about a month ago. And I mean, I made her wear I say made, but she was fine with it, but she wore her mask. And I kind of felt weird because I'm scrolling, you scroll on Facebook, you see other people's college students coming home and they're all hanging out and they're hugging and kissing. And I mean, I can't even tell you all, like, I'm going to try to say this without crying, but I can't even tell you, like, the last time I hugged my kids.
Yeah.
It's horrible, but I don't want to be the one to infect them, and they don't want to infect me. And so when she came home for that day, she wore a mask. And then when it was time for us, I think it was a warm day, and my older daughter came over too. She no longer lives in our house. So like now, neither one of my babies is part of my, me and my husband bubble. And so we ate outside. It was a nice day, and we went out on the deck and we ate outside and watched a movie somebody brought their laptop out and we watched a movie. But when they came indoors to use the bathroom, and that whole day and night when my daughter was here, she obviously slept in her bedroom, but otherwise she and I stayed 6 feet apart, and she wore her mask. Now, I did not wear my mask. That was another, we both should be wearing a mask, right?
It would be ideal, but it's okay if the person who's outside of your bubble wears the mask and you need.
That's kind of how we did it. She kept her mask on the whole time. And then when I think we did the day before, my oldest daughter came over, we had a meal, and I sent her to the other room. Like, we were probably 50 feet plus apart. I ate in the dining room. She went and ate in our family room, because her mask was off. So, I mean, sometimes when I do these things, I'm like, oh my gosh, like, am I just overreacting? But then I turn on the news, or I have a conversation with an expert like you, and I'm like, okay, Nicole, like, you just got to stay the course.
Yeah.
Like, I am definitely the COVID police in my family.
It's good. Somebody has to be it.
And thankfully, they're all understanding. And so I really, I want the parents that are watching this to just understand, we're not trying to scare you. But this really is serious. It really is. And I just want to go back to what you said, Dr. Alexia, when you said that, God forbid, if your student is responsible for infecting you or grandma or auntie or somebody who ends up getting really sick, or worst case scenario, succumbing to this virus, they will never be the same. They will
No,
never be the same.
no,
And
nobody's gonna shake that off.
exactly. So we just, and like you said, it can go both ways. You know, somebody else at the family gathering could give it to them. So we just, I think, you know, I know we're tired. I know there's COVID fatigue is real, but I mean, we're nowhere near being out of the woods. No, in
No.
fact, things are getting worse.
Yes. Worse a lot more quickly. And, you know, we were very lucky that the height of the pandemic early on was in the spring and summer months because we could retreat to outdoors. We
Yeah.
could seek solace in that, you know, I can sit at one end of my patio and my neighbor can sit at the other end of the patio. And, you know, you bring your own cups and your own wine and we sit and talk
Yes.
outside. But those days are about to be over, you
Yep.
know? And so even as cold as it was on Halloween, there still were tons of Halloween gatherings, indoors, outdoors, and we are now seeing the impact of that here in New York. You know, businesses are opening and people mistake businesses opening with it being safe or, you know, the pandemic being not as scary or not as serious. No, the economy opening is a financial decision.
Thank
You
you.
know, quarantining, isolation, social distancing, wearing masks in public is a scientific and a public health decision. So you can't let the fact that stores and restaurants are open influence the fact that you'll go sit down inside and eat. It doesn't mean that it's safe. And in fact, you're 2 times more likely to contract COVID if you sit and eat inside of a restaurant. So, and a couple of weeks ago, I would have said, you know, really just know the numbers where you're at. And that can help you determine, is it reasonable to go sit inside of a restaurant? But right now, even though we're at very low percentages of positive cases, those numbers are like kind of doubling on us. And, you know, I think it's 44 states have rising numbers consistently. And so, and we already anticipated there was going to be a natural fall surge. You know, we're dealing with a man-made surge on top of or overlapping with the natural surge in the virus, and it's cough, cold, and flu season. And
Yes.
so, you know, and the
Oh,
symptoms are identical. So you can't just assume because, oh, my symptoms are mild or I had the flu before and it felt like this, that it's the flu. You have to see what it is because each of those things requires a different response, a different treatment, and requires a different level of risk. You know,
yeah.
RSV is coming in, and that in fact affects
Good Lord.
infants, toddlers, and immunocompromised people. And then, you know, the regular old common cold virus and then flu and COVID look identical. So, you know, get your flu vaccine, encourage your students to get a flu vaccine at student health services and urgent care, a pharmacy or a grocery store where they go to school so that they're not bringing COVID or flu home,
That's
you
right.
know. And if there's symptoms, get tested. The wonderful thing about all this science and technology is that you might not have COVID, but you may have some other virus that we can name and we can predict the course of that illness. We can let you know how risky it is or what, you know, symptoms to be on the lookout for and who in your family is most likely to be susceptible or have problems with a particular virus or bacterial infection. So, you know, we have amazing capacity to test for multiple things and it's all the same swab for the most part. So,
Got it.
you know, don't be afraid to get tested because you may not have COVID. You may have something else that is very treatable.
Speaking of being afraid to get tested, before I scroll through these questions, that swab you talked about, you mentioned a little while ago, it goes up the nose and back into the nasopharynx. And certainly, I personally know a lot of adults who literally were like, I'm not going to get a COVID test because I'm afraid. Like, I don't want that thing going all the way up my nose. At my daughter's school, they are primarily doing saliva tests. But she's telling me they have, let me see if I can get this right. They have them with their mask on, they have them like cough. I guess to like get any viral particles that may, you know, into their mouth. So they have them cough a few times and then they have them, they're self-swabbing and they're like, is that as accurate as the test with the swab up your nose?
It depends on the platform. So
Mm.
different tests by different companies have, different sensitivities. So how often does it pick up or have a positive result when there's an infection present? And, different specificities, right? How often is the test giving you an accurate result? But as time has gone on and these platforms have really improved, we're seeing higher sensitivity and higher specificities for a test. So you have to make sure that the specimen collection is right for the particular platform that the test is being run on. If it's a nasopharyngeal swab, don't swab the inside of your cheeks and spit in the tube. That's not how it works for that
Yes.
test.
That's
So
different.
yeah, so we just have to make sure the test is being done as it's supposed to be. It's uncomfortable, but it's not horrible. I've been swabbed for COVID twice.
Okay.
And I've had a bunch of nasopharyngeal swabs for the flu in the past. And it's uncomfortable, but it's
You won't
manageable.
die. You won't
No.
die. We promise.
But I tell people, like, when my patients come in and they're like, oh, I had these symptoms and I had a COVID test, it really wasn't that bad. Well, if it's negative, I ask them about the specimen collection and I'm like, well,
Mm.
what did they do? How did it feel? And if they tell me, oh, they just, put
If
the
you're, if,
swab.
if it's not tears coming down your face, then it wasn't done properly, correct?
Right. We're not swabbing for MRSA. We're not tickling the front of the nose or the nares, right? We got to go up the nose and down the back of the throat. So if you didn't cough, gag, if your eyes didn't tear, like you said, you probably didn't get an adequate specimen and I can't trust your negative,
Very good.
There are places that are allowing people to self-swab.
I've
And
heard of that. I'm like, even as a physician, I know I would
I
not
wouldn't be
be
able to do
capable
that
of
to
getting
myself.
that thing up far enough. There's no way I'm going to stop as soon as I start to feel uncomfortable. Just like it's hard to put contacts in your own eyes and things like that. I don't understand this whole self-swabbing thing, at least not in the nose. I mean, the mouth, that's a whole nother thing, but
Right.
a nasopharyngeal swab that you do yourself.
I would not be able to do that.
I
I
don't
just would
trust
not.
that either.
Me either. So I'm like, no, go somewhere, do drive-through testing, or go somewhere where someone is doing the swab appropriately because
Yeah,
it's so important to know.
absolutely. Awesome. This has been amazing. Let's see. Hi, I think Dr. Yvette. Hi. Terry. Hello. Lisa.
Hi,
Hello.
y'all.
Larissa. Let's see. Catherine says this has changed my dental world. As a practicing dentist, we have always protected ourselves and our patients. Yes, that is a whole nother. Oh gosh, I'm overdue for my dental checkup.
Dental, ophthalmology.
Yeah, exactly. Let's see. I'm trying to see if there are any questions. Oh, Dr. Yvette talks about the football games at the colleges. Yes. Terry says, I have two kids at two different schools. One they test regularly, the other no testing. Christy says nothing like that at my son's school. Michelle says our son's school does daily check-in. Christy, must seek out testing if you want it. Yeah, so I mean, this is just indicative of what we were talking about earlier. These colleges are just making it up.
Yeah.
And to a large degree, it has to do with how much
It's a
money.
financial decision.
Exactly.
It's a financial decision. And, other people are making money or making efforts to not lose money at the expense of, our children's health, at the expense of their staff's health. And
Yes.
so we have to keep that in mind. Just because something is open or some service or some place to go is available to you does not make it safe. That has been much of the confusion. And then we get into silly stuff like, oh, I thought there was a pandemic. How come those people are allowed to protest? We want to have a parade and we want to go march. Like,
yeah.
Oh, okay. If you want to have a parade because people had to, fight for equality, then
Yes.
Okay, I guess.
Not the same, but
it's not the same, but okay. Like, understand that people are risking their lives because their lives are at risk,
Exactly it. Yes, that's true because you see all these explanations and I get it. I mean, we want, trust me, you all, I have been trying to think of, I was just texting my husband earlier and I was like, I miss my kids. Like I miss being able to, not that we were a super kissy family before, but I probably will be when this is over. So warning to my, I'm sure my kids are going to see this. Y'all are probably going to be sick of me when this is all over. But yeah, like you're trying to find ways or excuses like to make it all better, but it's just not. It's just not better, not yet. A couple of the parents have said that the semester it ends before Thanksgiving and the kids aren't going to go back until January. And that is true. And it's funny, at my daughter's school, that's what they told us initially, that after Thanksgiving, nobody could come back. And then they actually have a late start to their second semester. So they weren't going to come back till February. Then all of a sudden I started seeing emails that said, oh, now they can come back. And then I saw emails that said, and if you choose not to bring your child back, send your child back, there will be no discount on housing. And that's when I said, ding, 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 ding. So they probably started getting financial emails from parents saying, well, if you're kicking my child off campus after Thanksgiving, there should be a discount on my housing. And so then they decided, oh, well, guess what? Your child can come back after Thanksgiving. But I thought that was really smart to say, okay, after Thanksgiving, you guys just keep your little germy selves at home. And that would allow them that 14 days of quarantine that and the other experts are recommending. And then they're not bringing that potentially right back to the college campus.
Deal.
Yeah. So I think that was very smart. I mean, for the colleges that kept with that plan and are having the students stay home after Thanksgiving, I think that's smart. I don't really see any other questions, just a lot of comments. So thank you to all of you. Dr. Alexia, you have been amazing.
Thank you.
Thank you so much for joining me tonight. Thank you to all of you who are watching. So you all, just to summarize, for those of you who may joined us late, the summary statement is that Dr. Alexia, a board certified internal medicine doctor, pediatrician, and infectious disease specialist, has said that ideally our kids should stay where they are.
Let them stay on campus, let them stay on their apartments.
Yeah.
You know.
And then we talked about other ways that if they are going to come home, and certainly for those of you that said your kids have to come home and then they can't come back, you don't have a choice. So if you missed the beginning of this video, go back and watch it so that you can hear all of the tips that Dr. Alexia provided so that we can do our best at keeping ourselves and our families and our kids safe. This is really important, you all. I ask that you share this video. Please share it on your personal pages. For all of you who have kids in college, share it in your parent Facebook groups for your college and university. And I'm not saying that for me and Dr. Alexia's benefit. We don't get money off.
Valuable
Facebook is not paying us for this, but it's just really important to us that you all have accurate information. So please share this video with your friends, your family, your fellow college parents, your college parent Facebook groups. And, hopefully we will get through this. We are going to get through this. And I pray that you and your family stay safe, that there are no tragedies as a result of whatever your decision is for Thanksgiving break. Feel free to check back in on this page for information about, your college student and health. We talk about mental health, physical health, coronavirus, all things related to college and health and healthcare. So again, thank you, Dr. Alexia. You all have an amazing week. Please be safe, wash your hands, wear your mask properly, social distance, all the things. It is not over.
No, we got a long way to go, guys.
Yes. Thank you again, Dr. Alexia.
Thank you so much for having me on. Have a wonderful night.
You too. Bye, everybody.
Bye-bye.